yes, when I say female, you should know where we are getting at. That is something that is dealt with the cervix, like a condition that affects our cervix. And today we're joined by a doctor, Dora. Yes,
Laura Ajoko
yes.
a midwife.
Yes.
A midwife,
Sorry. Mrs. Please, very necessary. Mrs. Laura Ajoko.
Yeah, but when you classify it as doctor, I think doctor qualifies it better, right?
So Dr. Mrs. Laura.
Yes.
That's a long.
In fact, you've given me more and higher grade, but I'm really grateful.
Okay.
But the rank as a midwifery officer.
Midwifery officer.
Yes,
okay.
please. Yeah.
Okay.
So that one you just pronounce midwifery. No,
okay,
doctor,
you don't
no.
want it. Doesn't.
No, you can just say a
doctor.
midwife or a midwifery officer.
Okay.
I think that's best.
Okay.
That's
okay.
Well said.
Thank you. So today we are talking about cervical cancer.
Okay.
Cervical cancer. What is cervical cancer?
Actually, let's start from what cancer is. Then we know what cervical cancer is.
Okay.
So when we look at what cancer is an abnormal growth that happens anywhere or any part of the body.
Okay.
So when it starts happening over there, sometimes it's very numb, and then as and when it spreads, and the cancer cells find themselves in, and then they change the state of the cell. It is a cell that replicates. So they change the state of the cell and make it cancerous. And then from one side, where it's called the localized one or benign, then it starts spreading. As it spread, we call it metastasis.
Okay.
So it metastasizes and spreads to other parts of the body, depending on where it is found. So with cervical cancer, is a cancer that is found at the cervix. And the cervix is a part of the uterus. It's like a door to the uterus, an opening to the uterus. So the gateway of the uterus, which is, we normally call it the womb, is what we call the cervix.
Okay.
So the cervix opens up into the womb of the female. Okay. So we can see that it's at the lower part of it. So from the vagina, we find the cervix, then we go up into the uterus.
Okay.
That's the womb.
So what are some of the symptoms of cervical cancer?
Actually, there are so many symptoms that normally occur. There can be bleeding after sex. There can be bleeding after menopause, like women who are after menopause, you could see them still having bleeding. It's not menses. So you have to go ahead to do some various screenings to know what actually is happening to you. So it can happen after menopause. There can be bleeding in between your menses, and there can be variation. You know that you have your normal menses within this time, but this time around there is heavy bleeding. It's prolonging more than the normal. You have to also go and look at what actually is happening. And there can be discharge. Okay. Normally with some people they get discharge. The discharge can be in the form of watery, pale, bloody, sometimes it's pinkish, sometimes it's brownish. At the early stage, some people may have discharge, not bleeding. But the bleeding normally occurs when you see that there is variations from the normal. For some women within the age range of, let me say, 35 to 45 year onwards. So these are some of the signs. And then we have pelvic pain, when the severity of the cancer can make you have pelvic pain. And then you can even feel some pain at the back.
I see.
Yes.
But when I was checking it out, I also realized they said that pelvic pain usually occurs when you have intimates with someone. Or
yes, during sex.
But is it only during that time?
No, sometimes after the sex you can still feel pain. That is when the cancer has moved to another stage, let's say the 4th stage. They normally feel pain, unlike the early stages where you don't really feel pain. Or there is no pain.
Okay.
Yes.
The discharge, can you take us through the discharge, the colors? Because women get a lot of discharge. We have so many discharges. So how can you tell which discharge is actually giving you a signal that you are getting to cervical cancer?
So normally what is really peculiar about cervical discharge or discharge coming from cervical cancer, you see that the discharge is a little pale, and then it changes. So it can be pale at the early stage, very watery, and then you see it in the form of pinkish color, like the way after delivery or as you have your menses and your menses about to end, you realize that there is the change in color. Immediately you start your menses, you see it very red. Then the changes start as and when you progress from day to day. So you see it coming like pinkish, coming like brownish, that same form. So you see the discharge pale color, watery. You see it a little pinkish. You see it brownish. Then you see it bloody.
Oh,
yes.
Miss Laura, let's
and then with a foul smell.
Let's get it clear.
Yes.
Because like she said, we get a lot of discharge.
Sure.
So at what time, how do I even say it? We get a lot of discharge.
Sure.
But when do we know that this discharge is not the normal discharge that we've been seeing?
You know, normally, like I said earlier, that with the cancer, it normally have a range of people that we normally have a higher risk of them having it. So around the ages of, let's say, 35 to 45 or 44 onwards, you see that such people are more prone to having some of these things. But the normal discharge, you can have it whitish, you can have it a little creamy, you can have it a little yellowish. Then you sometimes, if it's very infected, you see some of them looking like more like greenish. Yes, so all those kind of discharge, you shouldn't wait in the home. No. You must rush immediately to see your health personnel in order to attend to it, because any infection around that area can travel straight to your womb.
It's okay. Now let's also talk about the causes. What causes cervical cancer?
Actually, cervical cancer is caused by a virus, which we call the human papilloma virus. And then this virus is normally found in humans. And then there are viruses that normally causes some infections we call STI, sexually transmitted infections or diseases, like I can say. So this particular virus is the one that particularly causes cervical cancer.
Okay, so that means that cervical cancer cannot be picked by the urine, or like when you use the washroom and tidying yourself, you can't pick cervical cancer.
Actually, you can't just pick it like that, but you can find the virus in a urine, during urine tests. Oh. Yes. About 80% tests have recorded that.
So does it mean that when we use more like the same urina, you are likely to pick cervical cancer?
Of course, some of these things, so far as it's from human, the possibility of you contracting it is very high, because this particular virus deals with direct contact. Do you get it? So it could be that the person has released it and you are the one going to sit on, let me say, the PV, the WC, and then they normally travel. Yes. And mostly they are found, or you normally contract it during sex. Okay. Because during sex there is direct contact.
So it means that men also
get the human papilloma virus. Oh, okay. But theirs, because you know the woman's organ is more open, theirs, because of the stature of their organ, mostly they have it in them. But for you to see it, unless maybe the symptoms are presenting, like you see that there is maybe you find some warts around their penis, or you see some warts around the vagina or areas. Some of these things are things that should alert you to be able to treat it, because this particular human papilloma virus causes mostly the warts.
Okay, so that means that multiple sex partners, the guys can transfer the virus to the women.
Sure. That's a very easy way to transfer. So we must be very careful with having multiple sex partners, because you wouldn't know who has the virus, and you will contact it from one person and spread it to the other. So far as it's direct contact. So having protected sex is more vital. And then having...
So does it mean that if you have the protected sex, that what is the chance of you not getting it?
of the protected sex is for those who are not married. Those who are not married and still want to do it.
Yes.
But for we married women, then you should have only one partner as your sex partner. You shouldn't have multiple partners as your sex partner, because you wouldn't know where you are contracting it and then where you are spreading it to.
Okay, so when it finally occurs, when I finally get the cervical cancer, what are the signs that will show that I have it?
So some of the signs are the bleeding, like I said. So bleeding in between menses. You can have bleeding after sex. You can have bleeding after menopause. You can have painful sexual, or let me say painful intercourse. You can have pain around the pelvic. Like I said, some of these symptoms should alert you, because you are the one who knows your system. You know that, oh, I have my menses within, let's say, 3 to 5 days. But this time around, your menses can even prolong as long as, let's say, 1 to 2 weeks. It's not normal.
So it means
it's unusual.
That basically, the same signs that you experience when you know you are getting cervical cancer are the same signs that occurs after you have gotten it.
Sure.
Oh, okay. Okay, that's great. And is it curable?
Actually, at the early stage, I would say it can be treated. Because it depends on the severity of the cancer or the stage at which you are. We have stages of cancer.
Then let's also look at the stages.
Okay, so we have stages. We have stage 0 to stage 4. Stage 0, you can find the cells stationed at one place, and it's not cancerous. It's just an abnormal growth. And stage 1, you can have it localized at one area. When we say localized, then they are all packed at one side. And like I said earlier, it deals with the cells. Cancer normally starts with the cells. It's the cells that replicate, and 2 or more cells comes together to form the tissues, and then 2 or more tissues come together to form an organ. So with this whole part of it, when they are localized on one particular area, let's say we find them around the cervix, but one part of the cervix, it could be maybe at the lower part or the upper part, they are stationed, and then they are not spreading, and they are localized. We call it around the first stage. Then we are moving to the second stage, where you have it spreading to surrounding tissues, and then some lymph nodes. We have lymph nodes around that areas, so we call it around the second stage. Then to the third stage, then they are spreading from the localized area straight to tissues, straight to lymph nodes, spreading to some organs. Then the fourth stage, that one, it spreads to it can spread to all parts of the body. From
all
where,
parts of the body.
Yes. It can move from, let's say, where the cervix is, affect the bladder, affect your rectum, then it's spreading. Yes, cancerous cells are very dangerous. And when they decide to spread, they can really spread all over the parts of the body. And so far as they communicate. Yes. Communication, as in they replicate. As they move, they spread. As they move, they spread. So wherever they touch, they spread. You get it? Because there are other cells, so they have to communicate with you. Oh, come and join me. Oh, come and join me.
Oh, like what's on our screens? There was one picture. It looked very small.
Yes.
Okay.
So this is a localized type.
Yes, this one.
Yes.
Is that what you are trying to indicate?
So you see, as they replicate, they increase. Then it's spreading all over. That is how it is.
So you are talking about the age, you're like, it's 35 and above. So does it mean that young people, like from their 18s, 20s, are not prone to getting cervical cancer?
Actually, it is rare to have young people having cervical cancer. Let me put it this way.
So from what age exactly?
From, let's say, from 15 years upwards. The teens is very rare among them. And let's say 20s is very rare.
So if you are 22,
but you can still get people around that stage having cancer.
Wow.
Yes. Cancer, irrespective of your age, you can get cancer. But with cervical cancer, around the ages from 15 is very rare among them. But let's say from 35 onwards, that one is high. They are at high risk. Let me call them high risk mothers. Or
So, how long can someone have cervical cancer without knowing?
cervical cancer itself, when it's not spreading, it can be localized for as long as, let me say, 10 to 20 years. You can have,
And
you can have
spreading
it.
and spreading.
You know, it depends on the human, your immune system also. Let me put it this way. Because if you have a very strong immune system, this system will also, one way or the other, try to fight it. So it can be stationed at one place and be there, because you are not feeling pain. Because sometimes at the early stage, there is no pain. You feel your normal life, you are just moving your normal daily lives. So because there is no pain, you will never know until maybe you start seeing some of the signs or the symptoms which will be presenting before it will alert you that, hey, there is something unusual happening. So let me give it a second look to be able to detect what actually the problem is.
I see. So if nothing happens, they will just be at one particular place.
They can
No
be there as
spreading.
long as 10 to 20 years.
Wow. And
Nothing is happening to
will
them.
it affect any part of your system if it doesn't show you any signs?
If they are not showing any signs and they are not spreading, so it can be there and be benign. Benign means that it's not spreading.
No spreading.
Do you get it?
Yes.
It's not spreading, it's not affecting any other organ. But when it starts to metastasize or spread, as we call it, then that is where you see it affecting surrounding organs.
All right.
So organs that are surrounded around that area can be affected.
Do we have types of cervical cancers?
Actually, cervical cancer is cervical cancer.
there are no
So we
types.
have stages,
Okay.
as in moving from one stage
to the
to
other.
the fourth stage.
Okay.
Yes.
So there's no fifth stage.
No, please.
Google told
In
me
fact-
there was a fifth
In
stage.
fact, then it's 4B.
Oh,
We have 4A
that
and
is
4B.
when it has already happened.
Yes,
and
at that
everything.
stage, then meaning that you should be counting your years down.
Hey.
Does it
Yes.
kill?
It kills.
Yeah, it kills. When you get it and it's not curable at the early stage and it reaches the fourth stage, you should count your years, about 5 years from then. Then
Wow.
you should be counting down the time you'll be meeting your grandfathers.
Then it means that cervical cancer is very serious than I'm thinking.
Sure, it's a serious thing that needs to be attended to. When you go to outside Ghana, they normally do screenings for them. The younger ages, they go to the hospitals for screening. But here in our Ghanaian society,
happen.
it's very rare that you see somebody walk into a hospital and tell the physician, oh, please, I want to have a cervical screening done or a pap smear done.
Okay.
To be able to know the state of your
Okay,
cervix
so-
is very vital. As women, as we move in our daily lives, we should be able to know the things that are happening to our bodies and know the state of our organs. Cervical cancer is one of the best things we should do, and breast cancer or cancer screening. So you can walk into, I know Ridge Hospital does it more. Kolebu is also there. Walk into any of these hospitals, have a pap smear done, and be safe.
Is it expensive?
It's not actually expensive. I think there was a time Ridge was doing it free.
Oh.
But as to what I know, you can have, let's say if you have 200 cedis,
You can.
have a pap smear done. And then you know your results and know whether your service is at a good state or healthy state.
I learned there is a test. I think it's a pre-test before the pap smear to
Okay.
check the area, the cervix area,
Okay.
before you go further to do the pap smear.
Well, if you want to do a pre-test, they can do the urine test like I told you, or we can do a dipstick test. If not, the best test is the pap smear.
Oh, okay.
Whether at the early stage or not, it's best to have the pap smear done. They'll just take some part of the cervix, they'll swab a little part of it with a dipstick, then they swab the midline of the vagina, you swab it, and then you put it on the slide. then you do this the smear, or you cover it up. There is this thing we put on it to make sure it doesn't spread to the other side. Then you have your pap smear done. Very simple.
And I hear you can use your fingers.
Yes. You can use your finger to determine the state of your cervix after your menses, but make sure your hands are well clean. You wash your hands with soap and water. Make sure there are no debts around the fingers.
Okay.
And then you use your index finger. You lie in a good position. You can do it in a lithotomy position where you lie at your back, your legs up, like when you are coming to deliver. We call it lithotomy position. Your legs up, your back straight on the floor. Then you can insert your finger deep down. So the normal state of the cervix is like the tip of the nose. So that is how the cervix looks like. But as and when you deliver, the state changes. Sometimes it can be like the shape of a mouth of a fish. That's when, as and when you deliver. But for a primate or somebody who have not delivered before, it should be like your pointed nose. Just
so
like
very
that.
Small.
Very small. The tip of the nose. So you can, when you go in there, you feel it.
So not the texture, but the
you
size.
feel the texture too. It should be soft.
Okay.
Yes. It should be soft. So, and it should be soft and a little firm to touch. Yes.
Can a midwife view your cervix? Like open you up, view your cervix, and see that you are not at risk?
No.
Can you just see and know?
With cancerous cells, you need to do the testing. There should be a microbiological test done. So with a pap smear will help you determine if the discharge or the swab taken is cancerous. You cannot just open the cervix and see it and see it as a pointed nose. It could be like that, very okay or safe. But if the cells are there, the cancerous cells are there, the testing will help you determine or outline it at the early stage.
Okay.
Yes.
Now, when it has already occurred,
we can examine the state of your cervix and know the shape and know the size and know if there are any anomalies from the normal ones.
Okay.
Yes.
Just by looking.
Just by looking. But for the cell to determine for cervical cancer, you need to do the test.
But just by looking, you mean what you can see it? Because I don't think you can see through.
We can see through. We can even pull your cervix out. Yes.
Oh, okay, with those devices and all.
Yes,
oh,
so
okay,
we have a
okay.
speculum that can open up the vagina to be able to analyze what you want to see around the cervix. So immediately you put in your speculum, you open up the vagina. So the cervix will just push out.
So it's removable and...
No, you can't remove it. It will just pop up.
Oh, okay.
Like it will inform you that I am here. And we will position you in such a way that immediately you open up, we put the speculum, we open it, we can assess your cervix.
Okay.
Yes,
so
and know its state.
How do we prevent this?
How do we prevent cervical cancer? I think one way we can prevent, there are so many ways we can prevent it. Regular checkups.
Okay.
So you visit more often to the hospital. You do regular screening. You do regular pap smear. And you can even have vaccination done. We have the HPV vaccines, which are also given to prevent the occurrence of cervical cancer.
Okay.
Okay, that sounds more interesting than I thought. But with that particular lithotomy position and all of that, and you even inserted your fingers there and all of that. But you also mentioned earlier that if you are between the ages of 15 downwards, you are not really at high risks of getting the way. But have there been chances that people within that range have ever experienced anything like that?
Sure. There are chances where people around that ages have gotten cervical cancer, but it's very few. Let's say out of 100, we'll say like 10 out of 100.
That means it's very, very rare.
Very rare among that ages. But among that ages, mostly they normally experience a discharge.
Okay.
Sure. The discharge, because they around that age, we in the Ghanaian society will say that we are not expecting them to be having sex, to say that the sex is painful.
Okay.
Do you get it? So they normally have the discharge, and we've clarified what and the state of the discharge and how it comes about.
Okay.
I also heard that the moment, even when they are 18 or 15, if they start having sex, they are open to cervical cancer.
Oh, of course. So far as the virus is gotten by direct contact, if your sexual partner has it, you just give it to you nicely.
Okay.
It will be welcoming by your service. So far as they are active in sex, they are prone at having it because it is something that is gotten from direct contact. So immediately you start having your sex, you can have it. You are prone to having it.
Okay.
And it is one thing that can also occur.
Okay. Earlier you mentioned HPV.
Human papilloma
virus. How do you know that as a woman? How do you know your HPV as a woman?
Okay, that is why you have to do the testing. So it is the testing that will outline whether you have the HPV virus.
So if you don't do the testing, it means you will never know.
You will never know. Sometimes you will see it normally presents itself in the form of warts. So you can see warts occurring around the vulva or around the vagina area. So it should alert you. So anytime you start seeing warts, then meaning that you should also move straight to the hospital and have a screening done at the early stage. Don't waste time at all.
Okay.
I want us to touch on the science again. I searched a little bit about it, and I realized that you were just saying that you can feel pain even at the lower abdomen and your back.
Sure.
Searching, I realized that cyst also gives the same sign.
Sure.
So how do you tell the difference?
What?
Cyst.
Okay.
Yeah. So how do you tell
cyst.
ovarian cyst? So how do you tell the difference that this pain I'm feeling is cervical cancer or I have a cyst?
I think you cannot only wake up because of pelvic pain and say that I have cervical cancer. It's not possible. So there are other symptoms that also present. And then we can have PIH, pelvic inflammatory disease. That can also give you pelvic pain. So there are so many conditions that can give you pelvic pain. But for you to be able to outline cervical cancer, you need to do the pap smear to be done, to be able to outline it. But for other conditions, we can have pain. Even with labor, you have pain. So you having pain, even with some people's menstrual menses, they do have pain around the same area. And during ovulation, some also have pain. So you having pain around the pelvic region does not only clarify you as having cervical cancer. We need to go in deeper to do screenings to be able to outline it.
Okay. Speaking of pain, is cervical cancer painful? Like when you're already experiencing it somewhere?
Yes. So that is where the pain comes. But at the early stage where it is very numb, it is not causing harm, it is localized at its corner, and it is there. There is no pain.
Okay.
Yes.
Since everything boils down to your cervix, how do we keep our cervix healthy?
I think one way you can keep your cervix healthy is by doing the screening, like I said. So regular checkups, regular screenings, regular pap smear, let me put it that way. Then you should have your vaccination. If you don't have it, you test and you don't have it, have the vaccine done.
And then the vaccine for cervical cancer?
Yes, the HPV vaccine.
Oh, okay. There's a vaccine for that.
There is a vaccine.
Even COVID-19 vaccine, we didn't even take that. How much more HPV vaccine?
Sure, there is a vaccine.
This is important.
Yes, it's really important because...
And is it expensive?
Actually, I don't know the cost of the vaccine.
Oh, okay.
So I'll find out and know actually the cost. But for now, I don't know the cost of it. But I think the hospitals have them. And irrespective of the cost, you should think about your health first. Because health is life.
Yes.
Health is more than money.
Yeah.
If you have good health, you have everything.
You have everything.
So I think the health of the woman is more vital because we women are more prone to such things. We must take good care of ourselves and do regular screenings, regular checkups, and make sure you have a healthy cervix.
Okay. And going back to pain, how do you determine, or how would you also describe when you're having a leg pain during your cervical cancer stage?
Like I said, because everything relates to the nerves.
The nerves.
There are nerves endings that connects to the back.
The back.
So such nerves, so far as they are they are included, or let me say they are parts of the area where the cancer is, and the cancer is also as its stage where pain is more likely to occur. You have the leg pain.
But how does it feel like? How will it feel like?
It's very painful. It's like you having joint pain.
Okay.
Oh,
Yes.
okay.
And
Very
sometimes you
painful.
need to either
Stretch
or
a little to free them.
the nerves.
Yes.
Okay.
So that is why regular exercise is
It's
also
also,
very
you know,
much
everything
important.
goes
Yes.
back to most of the
Exercise.
things we've been talking about here.
And we always say that what we eat makes us. So
Sure.
does cervical cancer also falls in that range? Do we have some things that we can eat to actually help us prevent it?
Yeah, I think one thing is building your immune system. Building your immune system
It's
comes
everything.
more with eating more fruits and vegetables.
Okay.
Because the fruits and the fruits will give you this citric part of it, and then we get some minerals out of your vegetables. So all of this builds up your immune system. So if your immune system is very strong, you have built it with more fruits and more vegetables, I think it's going to help you way well, because this virus, when they are there and they realize your immune system is strong, because the immune system that fights. Do you get it?
Yeah.
So if your immune system is very strong, it does fight infections that are coming to you. So sometimes they can localize them and prevent them from spreading, because the immune system itself is strong. So the kind of food we eat is very vital. So you have to eat well, eat more of fruits and vegetables, so that you have a good and healthy immune that will help your body to fight any form of infection that comes to the body.
Okay. So let's get into supplements and stuff. You know, nowadays we get into supplements, we're taking this, we're taking. How does that also affect our cervix?
Actually, let me say supplements they normally comes in the form of the vitamins, minerals, like I said. So some of these supplements, they are just there to add up to what you are taking orally. But I would prefer that you take the healthy food rather than doing the supplements.
Oh, okay.
Well, if based on your health, we realize that you still need supplements like the vitamin C, the soluble vitamin C, and we have other supplements, minerals that you can take as a woman to build you up. They are also necessary in some way. But if you can have it directly from your fruits and vegetables, why do you have to waste more money to have the supplements? But now our fruits are very expensive. So we can still have the supplement taken, but it shouldn't be a norm that you should use it for the rest of your life. You can just have more of the freshness or the fresh fruits and the fresh vegetables than adding up with the supplements. But the supplements are virtually also good, depending on your state. If the doctor says, okay, let me add up this to your normal intake, I think it's good to go.
Okay. And also, this is just by the way, you know, nowadays we try to go local, natural. Are there natural remedies that we can actually adapt to, like cooking at home, to actually help build our immune system in terms of preventing this?
With a natural remedy, like I told you, I'll prefer you taking it directly, taking the fruits directly, than preparing some of these natural remedies. You end up causing harm to your body than doing good. You end up doing it nicely, but the quantity that you are taking would be harmful to your body.
Okay.
So in my personal life, I don't prefer taking concussions. I prefer to do the natural remedy and have it done. So the natural remedy, you can have your fruits, and if you like, you can take your vegetables also as well.
Miss Laura, can we do specifics? What's
natural
types of fruits? Maybe apple, banana, this, or all types of fruits?
All type of citric fruits are good.
Okay.
We have vegetables. We have so many vegetables. We have tomatoes. We have all of them have the nutrients at which they add up to your immune system. Do you get it? So all vegetables are good. All fruits are virtually also good. So eating them day in and day out. So you shouldn't eat one-way fruits. You should change them. As and when you eat, you change them. There are some fruits which are more acidic that people may say that, oh, when I take this one, I feel heartburns or something. You look at your body and look at the things that works well for you. Then you'll be able to go by them.
So how many people die from cervical cancer in a year?
In a year, I'll say that we can have, let's say, 20 out of 100.
20, that's a lot.
Yes, that's a lot.
What is the age range?
The age range of people normally dying within the 35, 40 to 60 upwards.
Oh,
wow.
Yes. So because they are at higher risk,
Okay.
those who are at higher risk are more likely. And when you don't detect it at the early stage, and you normally find yourself having it getting known at the latter stage, then I told you, you start counting down your years.
okay.
So like 5 years.
What makes the 35 people at higher risk? What makes it? Is it their age or the fact that they are exposed to sex?
Their age, and then I think, like you said, the fact that they are more exposed to sex, because they, around that age, we expect that they are having sex, they are delivering. You know, there are so many things that happens to them at that stage. And at that stage, you are aging.
Yes.
And as you age, the strength of your cervix will not be the same as somebody who is at the younger stage.
Oh.
Yes. So as you age, your organs age. And they also get tired. Yes. They also get tired. So we see our old women and we are making fun of them. You say, oh, you can't walk, you can't do this.
They are giving
you will
up
get
on
there
us.
and you understand what they are going through.
Okay.
So as you age, your organs to age the
Okay.
same way. So a woman can come and deliver, let's say 4 or 5 times. You realize that the shape of the cervix is not the same like the tip of the nose again.
Oh.
Yes, it changes shape. Because around that time, it has gone through so many processes.
Okay.
And you having sex is also another thing. By that age, you would have had numerous sex. Do you get it?
Yes.
So you can't compare that age to somebody who is at 15 years who doesn't know even how to have sex.
Okay,
let me
so
put it that way.
what about someone that is of that age that haven't been exposed to sex?
Somebody who is at that age that haven't been exposed to sex, that doesn't mean you are not prone to having cervical cancer. Cervical cancer is an abnormal growth, like I said. It's an abnormal growth that occurs. It can decide to occur any part of your body, irrespective of even when you have not had sex.
Okay.
You can trap the virus. Do you get it? But mostly it's when you have sex.
You have sex.
That is
but
where...
Miss Laura, let's get something clear while we wrap up.
Okay.
Is it that when you are having the intimate or sex, as a matter of fact, whether the person has the HPV or not, you are still prone to it, or it's when your partner has the HPV?
Actually, from age 35 to 40 upwards, you are prone to it. But when your partner also have it, it makes you higher risk or more prone to having it. That is it.
And if you are above that or beneath that age, it means, and you don't have, or your partner doesn't have the HPV, it means the risk is even a bit
less. Yes, it's very rare.
Okay. So it's not just about having sex, it's about having sex and having the HPV
virus.
Okay. Okay, thank you so much.
What are you going to be your last words to the ladies watching us this morning?
Okay, so my last words to my precious ladies watching me today, I would say that health is wealth.
Yes.
If you have good health, you have everything. So we should go to the hospital regularly, have regular checks done, and have our screenings done. If you finish your screening and you are safe, have a vaccination done, and you are good to go.
Okay.
So that is what I'll tell my precious lady out there, that we should be more cautious about our health than any other thing, more especially we the women, because we are more prone to so many health issues or health related problems.
Okay.
And how do people also find you if they want to reach out to you in relation to the topic we've discussed?
Okay, so if you want to reach me, you can reach me on WhatsApp. My WhatsApp line is 0261 668390. Or you can reach me at Mana Mission Hospital. I'm at the labor ward, and that is where I reside.
Okay.
And then I think that's best.
Yes.
Okay.
That's the easy way you can reach me.
Okay.
Wow. Thank you so much, Miss Lara. Thank you. It was great having you. So that is from Mrs. Lara Midwifery. Yes. So you heard everything. I don't have anything to add to it. So if you're a young lady out there between the ages of 35, your age alone makes you open to cervical cancer, so you need to check that. And also when you're open to sex, then you need to also go and get a pap smear so you prevent it. We're still here on Sunup on Shobiz TV. We'll be right back. I'm gonna do my part and make this up.